Good afternoon, everybody. Today we are presenting the giant anterior urethral diverticulum from our Sridhar Kidney and Eye Centers, Hyderabad. In fact, we have seen one of the rarest cases in the world that there are diverticulae which are very large to the extent of 8 to 12 centimeters. Generally about diverticula 2 to 3 centimeters only, but in our case we have found two major giant diverticulae which are actually reported to be one of the largest in the world. Next slide please. If you see, the 50-year-old man actually came in a very toxic condition, very sick condition, running high fever, and he told that there was a small swelling like thing on his scrotum for a long time, for more than 25 years, and he didn't bother much because his stream was good. But when we did an X-ray, this is how it is, the plain X-ray, it showed that there is a large stone of about 12 centimeter in the pelvic area, just below the scrotum area. So when the X-ray was taken, we were surprised where it is lodged. It is in the anterior urethral diverticulum. If you see, that is the urethra, and there is a stone in the large diverticulum which is below the anteurethral wall. So then we realized that it is a urethral diverticulum lodging a stone for more than 24 years, and lot of urine was leaking from the outside, from the diverticular wall, and we have first opened it up and then exteriorized the diverticula. A lot of pus was removed. Once his condition has stabilized, then we have done a diverticulectomy. When you see here, the diverticulum was almost 13 centimeters, and after the critical condition has come out, then we have actually repaired the diverticulum in a second stage. This patient, who had lodged the stone for 24 years, has recovered fully after the excision of the diverticular wall and then repair of the urethra. The second case is where, the next slide please. If you see, the second case, there was a diverticulum in the lower portion, bulbar part, which is parallel to the urethral stream. Urethral diverticulum is along the urethral wall, and then when we saw with X-ray, it was actually filling along with the urethra and pressing the urethral wall so that his stream was poor. When we actually opened it up, this is how it looked. There is a large anteurethral diverticulum which was projecting and filling with urine. We have cut open the extra urethral wall, urethral wall, and then repaired the entire area, and there was a good response. If you see the first slide, go back to the first slide. This stone is almost around 1.5 kilos that was lodged in the urethral diverticulum, which is one of the largest in the world. And after removing this is how it looked. So the removal of the stone and repair of the diverticulum has given excellent result. Next slide please. And if you see this also, the diverticular wall is too much redundant. We have repaired over the urethral catheter, and after 6 weeks we have taken X-ray to find whether it has been totally repaired and urethral stream is good. Can you go to next slide please? If you see here, this is the X-ray after the surgery. This is the bladder, how this urethral wall is smooth and narrow, and the diverticulum what was here was excised, and then the stone was removed and pus was removed. So these are the two large urethral diverticulae which are reported in the world to be one of the biggest, and the cause of this is lack of the muscular wall. It happens sometimes because of stricture, sometimes it is congenital. Whatever it is, extra length or extra width of the diverticulum will be cut off and normal urethral caliber will be restored. That's how the repair is successful. And these two cases, next slide please, these two cases outline the extremely rare condition of anteurethral diverticulae, which can lodge stones and infection, and they can be repaired properly if care is taken that the diameter is held to be normal, and post-op X-rays show that the diameter of the urethra is same as the rest of the urethra and stream is very good, and these patients are on the follow-up for more than 15 years. Thank you.